Honourable Member for Charleswood-St. James-Assiniboia-Headingley.
Thank you, Mr. Speaker. It is an honour to rise today to speak in support of Bill C-37, an act to amend the Controlled Drugs and Substances Act and make related amendments to other acts. This bill directly addresses the national public health crisis of opioid overdoses and provides measures to prevent increasing harm to Canadians and communities all across the country. I would like to speak to the importance of two key components of the bill, including, number one, streamlining the process of supervised consumption sites, and number two, providing additional enforcement capacities to Canadian Border Service Agency, which will help prevent illicit opioids from entering Canada through international routes, and therefore reduce the risk of controlled substances entering the hands of Canadians. These components of the bill are critical to Canada's fight against the opioid epidemic that is currently sweeping across Canada. As we know, when the previous federal government decided that it would not extend the legal exemption for Insight in Vancouver, advocates initiated a legal challenge, which reached the Supreme Court of Canada. In 2011, the Supreme Court ruled that the health evidence in support of Insight was substantial and opened up the possibility of establishing additional facilities in Canada if there was an appropriate balance between achieving public health and public safety. This balance was organized into 5 criteria. Number one, evidence, if any, on the impact of such a facility on crime rates. Number two, the local conditions indicating a need for such a supervised injection site. Number three, the regulatory structure in place to support the facility. Number four, the resources available to support its maintenance. And number five, expressions of community support or opposition. Simply put, this legislation removes the burdensome 26 application criteria put forward by the previous government and instead uses the 5 factors outlined by the Supreme Court of Canada in its 2011 ruling on Insight in order to streamline the process. It has been established that opioid addiction is typically chronic, lifelong, difficult to treat, and associated with high rates of morbidity and mortality. Our ultimate goal is to reduce and ultimately help eliminate opioid addiction. But first, we have to stop people from dying. And we know that supervised consumption sites work to do just that. Just a few of the organizations that support supervised consumption sites are the Canadian Medical Association, the Canadian Nurses Association, the Canadian Association of Nurses in HIV/AIDS Care, the Public Health Physicians of Canada, the Canadian Public Health Association, the Registered Nurses Association of Ontario, and the Urban Public Health Network. Furthermore, international organizations such as the World Health Organization and the Centers for Disease Control are in favor of harm reduction services. As a member of the Standing Committee on Health, I had the honour of assisting with the swift passage of C-37 through the committee stage. With the current health crisis across Canada, the rapid passage of this bill is imperative. Time is of the essence to help save lives. And as I have previously mentioned, a key outcome of this legislation is that the length of time required to process applications for supervised consumption sites will be significantly reduced, while still providing the necessary balance between public health and public safety. Many witnesses throughout the Standing Committee of Health study on the opioid crisis stated that there are significant barriers associated with the previous government's Respect for Communities Act and its 26 criteria. This act created an onerous application process for community groups wishing to apply for a supervised consumption site, as evidenced by the lack of applications that have been successful since this legislation was put in place. For example, 3 supervised consumption sites were approved last month in Montreal under the previous government's legislation. Although their approval is positive, the time it took to process the application was quite long, as it was submitted in May 2015. Mr. Speaker, that is 17 months the City of Montreal had to wait to assist their vulnerable citizens with opioid addictions. That is too long. I agree that the important criteria must be met before supervised consumption sites are established within communities. But the application process must reflect the urgency of the situation. I believe that C-37 does just that. One significant statement that had been made during the Standing Committee on Health's clause by clause on C-37 was from the honourable member from Vancouver Kingsway. He stated that on the first day that Insight opened, they reversed 15 overdoses. That is a staggering number of people saved in one day. By streamlining the application process, Bill C-37 will ensure applications are improved in a timely fashion, paving the way to save more lives. For example, at Insight, there have been over 4,922 overdose reversals, and not a single death has occurred at their facility. Supervised consumption sites save lives and help reduce the spread of HIV and other infectious diseases. I was shocked to hear that in 2016, in BC alone, a total of 914 people died from an overdose, an 80% increase in the previous year. This alarming statistic shows that it is our responsibility as federal members of Parliament to act now. Another key component of this legislation that I wish to speak on is how it addresses the illegal supply, production, and distribution of drugs. One of the key findings of September 2016 report published by the RCMP regarding the current opioid crisis Canada is facing was that China continues to be the pivotal source for illicit fentanyl and its analogs, precursors, other novel emerging opioids, and tableting equipment that supply Canada-based traffickers. Bill C-37 addresses this issue by proposing to give Canada's Border Services officers greater flexibility to inspect suspicious mail, no matter the size, that may contain goods that are prohibited, controlled, or regulated. The current legislation prohibits the CBSA from opening suspicious mail that weighs 30 grams or less. If the CBSA found such a package, they would have to seek the permission of the addressee, which would prove to be difficult. This gap in enforcement capacity is problematic, as just one standard-sized mail envelope, 30 grams, can contain enough fentanyl to cause 15,000 overdoses. Given the prevalence of illicit drugs found in international packages is greater than domestic mail, this measure would only be for international incoming mail. Our border agents need to be given the clearance to inspect these packages to help stem the flow of illicit drugs entering into Canada. According to the same report by the RCMP, in May and June of 2016, the CBSA intercepted for the first time 2 separate shipments of carfentanil, which is estimated to be 100 times more potent and toxic than fentanyl and 10,000 times greater than morphine. So we know there has been an increase in trafficking, and it is our responsibility to equip the Canadian Border Services Agency with the tools needed to stop it. Bill C-37 is a bill that will save lives, Mr. Speaker, whether that is by the seizure of a shipment of an illicit opioid by the CBSA or through the nurses at new supervised consumption sites whose application was approved based on the new set of 5 criteria. This legislation is the next step in fighting the crisis that we are seeing across Canada, and I believe that this bill is a step in the right direction to help Canadians today. Mr. Speaker, many Canadians are one overdose away from becoming another tragic statistic in the ever-increasing Canadian epidemic of opioid addiction. This evidence-based legislation could not be timelier. With these rising fatalities, it is now more important to act. It is my hope that C-37 will be granted the same swift movement through the Senate as it has been granted in the House of Commons. It will enable Canada to tackle this nationwide problem and help ensure the safety of vulnerable Canadians. The faster it is enacted, the faster it will help save lives. Thank you.